All right, thank you very much, and welcome everyone. Today we're going to be talking about non-physician practitioners, actually a little bit broader than that. We'll also talk about and try to put the practitioners in the context of non-physician providers, which is a little more general term. Please note that terminology varies in this area, so make certain whenever you're studying rules, regulations, credentialing, whatever it is you're doing, that you understand completely the context in which you are working relative to the terminology. Now, you should be looking at the title slide, which is not particularly interesting. You'll note my email address is about 3/4 of the way down on the left, Dwayne at AACIweb.com. Well, we're going to be using the word practitioner. Now, I'll tell you right now that generally when I use the word practitioner, that means some sort of a non-physician healthcare provider who can be qualified to bill the Medicare program. Now, keep in mind, Medicare is sort of our benchmark because we have all of their rules and regulations. When you move over into the private third-party payer area, they may have their own rules and regulations, and so there you'll have to check with them. But generally, what I'll be referring to today is in the Medicare context, and then you'll have to extrapolate that out into the private third-party payer. So when I mention the word practitioner, that usually means that these folks can bill professionally. When I refer to non-physician providers in general, I'm referring to those folks that cannot or possibly simply do not bill professionally. Now, this is an area that is growing rapidly. And there are a lot of political turf battles, particularly at the state level, all right? Let me give you one example. Certified medical assistants, CMAs, generally non-physician providers. They are not practitioners. But what can they do? Or more to the point, what can't they do? And I know recently we've had some questions about CMAs providing injections. Well, I'll give you the framework today to look at a question like that. The biggest part here is going to be, are they qualified? Are they trained to provide injections? And then are there any scope of practice laws at the state level that either allow them or delimit them from doing something like that? So we have a lot of political turf battles out there. Now, the way in which to code and bill for these folks varies quite widely, and this is why you have to analyze carefully and understand the context in which you are working. There's constant change, both at the national and state level, multi-level compliance concerns, and we have federal rules, we have state laws, we have licensing, we have professional organizations, we have credentialing, we have all kinds of things going on. And then also we need to understand exactly where we are utilizing these folks, whether they're practitioners or, and I'm going to use the word just a provider, one that cannot bill professionally. Are we in a provider-based clinic? Are we at the hospital? Are we in a freestanding clinic? Are we at a rural health clinic? Are we at a critical access hospital? And yeah, that should be CAH there at the bottom of slide number 4. CAH, critical access hospital. And then we have highly variable sources of information. Slide number 5 are the objectives. Now, I've already indicated to you that the overarching objective today is to give you a framework in which to analyze any particular type of non-physician practitioner / provider. Now, we'll get into some coding conventions. We're going to get into the concept of being provider-based. You'll see there in the middle of slide number 5, we're at least going to have to mention the Medicare physician fee schedule and the ambulatory payment classifications. We'll also get into this whole thing at incident 2. Now, we could spend the full 90 minutes